amoureux. Leur bonheur se construit sur un air fait pour eux. Sous le pont de Bercy, un philosophe assis, de musiciens, quelques badauds, puis des gens par milliers.
حلقتنا لليوم من باريس، من عاصمة الجمال والفن. ومثل ما بتعرفوا انه الفن هو جمال والجمال كمان هو فن. مشان هيك اليوم رح نقضي نهار سوا نحن وياكم مع قائد الجمال ومبتكر الفن يلي هو بروفيسور سيدني أوهانا. مشوا معي لنروح لعنده ونشوف هالشخصية يلي ورا هالسكسس ستوري، نتعرف عليه أكتر، نتعرف على التقنية الجديدة بعالم البلاستيك سيرجري.
Je suis né à Marrakech, mais tout enfant déjà, je nourrissais le rêve d'habiter près de la Tour Eiffel, parce que c'était pour moi le symbole de la beauté, de la majesté, le symbole de Paris, capitale des arts.
منبلش بالترويقة سوا نحن وبروفيسور سيدني أوهانا. مشوا معي. Bonjour.
Morning.
Est-ce que professeur Ohana est là?
Oui, bien sûr, venez, je vous amène le professeur Ohana.
Bonjour.
Hello, Claire.
Bonjour professeur.
Nice to meet you.
Me too.
I was waiting for you.
First, with what we start? With the
We
coffee?
start with a coffee and orange juice after that.
Okay.
Okay.
Okay, so no one gets hurt with the caffeine. Professor, today we are going to know the man behind the successful story, behind the art and beauty, behind plastic surgery, behind the new techniques, behind all your world. You are so easy, cool, simple all the day. How do you start your day to maintain yourself like this?
When I awake in the morning, I go in the garden down and I walk or I run during half an hour around the Eiffel Tower. It was my dream. And when I was young in Morocco, in Marrakech, my dream was to live close to the Eiffel Tower. So I'm so happy to have the possibility to do that. But it's for me something of tranquility.
Yes.
After that I come to take my breakfast and I think about all my program of the day, all the operation that I have to do. And for me it's a big pleasure to make operation. I'm not afraid at all of any surgery. I have 35 years of experiences.
Wow.
So it's only pleasure all the day with nice women speaking about their beauty.
Yeah.
I'm very happy.
Yeah. Was it a push for you to sculpture women, to look at their beauty as your icon, as your first lady? So that was a push in a way?
I love art.
Yeah.
And every weekend I'm in museum.
Yeah.
Every weekend I go to see atelier of sculpture and I have many sculpture of art. It's for me something who give me inspiration for the beauty of women.
Yeah.
And during the day, when I speak with a woman about that, I'm speaking like an artist who wants to realize something artistic with the surgery.
Yeah. Wanted to be a cancer, specialized in cancer. But the dream was changed a lot because of a family problem, your father. So tell me the story and how you became a surgeon.
When I was young, I want to help everybody. And for me to help them, it's to be doctor. And to help them with very efficiency, it was to be surgeon. And for me, the cancerology was something very important to do. But when I was young, my father has had an accident and he has 2 nerves cut and he needed to have plastic surgery. And I have seen when he went in Paris many times and when he was coming back in Morocco, but he can move his hand after this accident. And at that time, I decided that I will do also cosmetic, I will do also plastic surgery and reconstructive surgery.
Wow. So now it's time for the orange juice for vitamin C. Cheers then. And we need the vitamin C to continue the whole day because you're such an active man. We have to follow everything what's going on at Clinique Petrarch. You started your internship in 1975.
Yes.
And then after, you have a lot of success and you work and you were so talented, you worked so hard. Then 1994, 95, you were the president of the Plastic Association, French Association of Plastic Surgery. So, what's your ambition?
I was one of the youngest internship in France, and I wanted to go all around the world to see all the techniques and to decide and to try to innovate,
Yes.
to have innovation,
Yes.
because it was a new specialty.
Yeah.
And I did that during 10 days all around the world.
Wow.
And when I came back with all these experiences, it was for me a good baggage to learn new things, to educate other surgeons with the new techniques. It's something that I like a lot, to make education.
Oui, parfait. Est-ce que j'ai l'impression d'avoir déjà arrivé?
من بعد ما قضينا هالنهار تروقنا وبرمنا بالكلينيك صار لازم نحكي نحن وياه. Professor Sydney, I want to know, or we want to know the definition of beauty in the 21st century. What's your opinion?
You know, Claire, for me, the beauty is not a question of beauty, a problem of color of skin or morphology. And there is no universal beauty criteria.
Yes.
A nice woman is a self-confident woman who have a natural elegance and charisma. She knows to be a little bit mysterious and enchanting, charming.
Okay. So this is the definition of beauty in your opinion?
Yes, we just can help her
Yes.
to be self-confident because we will help her to have nice look.
Yes.
And with that,
Yes.
it will help her to be beautiful.
Yes, of course. So tell me, is a plastic surgery now, is it a luxury? Because we know it's not cheap, it's expensive. Or it is a must for every lady to have this beauty, to make this plastic surgery. So what can you classify? It's a luxury or it's a must?
Now in France, for example, it's very democratic.
Yeah.
It means everybody can have plastic surgery, cosmetic surgery,
Yeah.
because we can have enough money to do it.
Yeah.
And it's not only the stars who are doing it. So everybody can have beneficiency of
Yes.
this kind of surgery.
You know, nowadays, if a lady sees a little bit of wrinkles here, a little bit of wrinkles there, they do not accept. They will come directly, please, we need a Botox, we need... Do you think this is normal? Or it's nice to have some wrinkles?
It depends on the age.
Yeah.
It's nice to have some wrinkles, but not too many wrinkles.
Yes,
It's another age.
yes,
If you have a little bit, it may be charming.
Yeah.
If you have too many, you have to reduce them with Botox and with
Yes.
fillers.
okay, and fillers. So, and what are the kind of fillers, like our own fats? Or you believe in these hyaluronic acid, in these injections, whatever kind of injections?
For the small wrinkles, it's preferable to use hyaluronic acid.
Yes,
But if you need to have more volume, like in this part, the pomade,
yes,
le menton on the chin, in this part you can use fat
yes.
by injection.
Okay. Do you think with the plastic surgery, Professor Ohana, that the plastic surgery is giving women the ultimate perfection? So she's now super beautiful, the right nose, the right lips, the right eyes, the lifting, whatever, and now she's super perfect.
You know, at the beginning I wanted to make cancerology, and I began to do it because I was used to do breast cancer.
Yeah.
And every day I was taking 1, 2, 3, 4 breasts, and it was terrible for me.
Yeah.
Because we wanted to make a reconstruction of that.
Okay.
So after the cancerology, I decided to be specialized in reconstruction, and it was
Okay.
the beginning of reconstruction 30 years ago. Now we are doing nice reconstruction. So I did my specialty in reconstruction, plastic and cosmetic,
Okay.
just because at the beginning I was cancerologist of
Yeah.
the breast.
Okay.
For me, there is not only one way to be nice, to be beautiful, and we don't have to make everyone the same, with the same
Exactly.
with the same shape of eyes, with the same cheeks, with the same chin. No, it's absolutely awful to do that.
Yeah.
Everybody has to be different and nice in this difference. So
Okay.
the best important is to stay natural with every face.
Yes.
So for that, we have not to be surgeon, we have to be artists.
Nous sommes situés à Paris dans le 16e arrondissement. Nous recevons de la clientèle donc internationale. Nous avons pas mal de choses à vous proposer en ce qui concerne l'esthétique. Donc, nous recevons une clientèle du monde entier, des pays du Moyen-Orient, de la Suisse, de Belgique, des pays d'Afrique et d'Europe également.
نحن موجودين هلا بالبلوك اوبراتوار، بدنا نشوف عمليه ليفتينج، ما بعرف قديش بنقدر نتحمل، بس نحن مع دكتور سيدني اوهانا. Dr. Sydney Ohana,
Yes.
what were you doing here? Breast enlargement. So after, what do we have?
I just finished breast implant,
Yeah,
and now I'm going to do a small facelift.
a small facelift.
Yes.
Okay, then
Look
tell
at-
my viewers, stay with us. We're going to a small break and we'll be back.
With pleasure. Okay.
With pleasure. خليكن معنا.
est heureux. La bohème, nous ne mangions qu'un jour sur deux.
Each client, she might come to you. For example, I'm in front of you. I don't have a nice nose. I will tell you, give me, please, I want to make the nose of, let's say, Nicole Kidman. I want the Jennifer Lopez cheeks. I want the mouth of Kim Basinger. So how do you deal with your clients if they ask, like for example, because now plastic surgery, as if we are buying a jacket, okay? So how do you design?
I tell them we are not good.
Yes.
We are just very good technician,
Yeah.
artists, and we cannot do all what you want.
Yes.
And the nose of Nicole Kidman will not be
Good
a nice
for you.
nose for you.
Yes.
So we have to have a nose personalized in your case, and everything has to be in adequation with
the-
your face,
Yeah.
with your morphology.
Yes.
So if she doesn't understand my explanation,
Yeah.
I don't make operation for her.
Ah, good. Any client that was not satisfied with you, for example, you have a client, she was not happy with the result, or you did her something, you feel that this is good for her, and on the contrary, when she saw herself and after a period, she said, oh no, Professor, this is not what I wanted. Did it happen with you?
Yes, it happens sometimes, not in the face, not in the nose, but in the breast.
Yes.
Sometimes we decide the size of the breast, and after that she told us, no, it's not enough, I wanted more
Yeah.
or less.
Yes.
In this case, it's not so complicated to change it just with local anesthesia. But for the face, we have to decide exactly before the operation, because it's not so easy to move and
Yes.
to change after that.
Yeah.
So if there is not a very good connection between the surgeon and the patient to understand exactly what she wants,
Yeah.
what we can do, we have not to operate her.
Ah, okay. But
We
you
need
know,
this connection before.
yes, but you know, some ladies, when they are aging, like in their 60s or 70s or whatever after 50, they expect always to become younger and younger, like they were in their 20s. So do you have any problem with these ladies? Because we are always seeking, even us, to look the best, to look the more beautiful, and to have this bien tiré. Comme on dit en français, c'est bien, well attached.
Fortunately, we have only a few cases like this.
Okay.
Patients, we call them dysmorphophobia. It
Okay.
means they will never be happy because
okay.
they even didn't understand what they want exactly.
Yes, yes.
So in this case, we have to ask them to go to see before a psychologist.
Ah, okay. Do you think that plastic surgery is a kind of psychology?
Yes, it's side by side with psychology.
Yeah.
The only difference, the psychologist, he try to help you with the parole,
Yes, to
speaking
talk.
with you, with
Yeah.
the thought, and we are trying to help the patient with a bistouri, a scalpel.
Ah, yes, to sculpture the face, to give more touch, more look,
You know, when
nicer
when we
look.
have a nice result,
Yeah,
it has a very good resonance in the head.
of course, from inside out then. صار وقت نحن وياكم نتعرف على أحدث التقنيات يلي كلياتنا ناطرينها من دون اللجوء إلى عملية جراحية. كيف فينا نبين أصغر وشو هي الطريقة؟ What are the latest technology you introduced to plastic surgery?
In France, we have been every time in avant-garde.
Ah oui.
Avant-garde in the techniques of rajeunissement de façon la plus naturelle,
Yes.
a natural look, and not at all a surgical look.
Okay.
And for that, the French style, the French touch is very well known all over the world.
Yeah.
If we don't want to have a lifting because it's too early, we can use now threads.
Yes.
It means des fils crantés qui permettent d'obtenir un bel ovale, a nice shape.
Yes.
And this is very à la mode en ce moment en France because we don't need narcose,
Yeah.
just local anesthesia
Yeah.
1 or 2 days later, we don't have any swelling, any blue marks.
Yes.
And after that, we will have in a few weeks a very nice shape.
Ah.
It's not like a lifting because it will not long lasting
Yeah.
like a lifting 10 years. No, only 2 years, but for many persons it's enough and we can repeat this technique.
Ah, okay.
I will show you that in my operating
Yes,
room because
yes.
I have someone to operate in a few minutes.
Yes, okay, so we will share the operating room.
Yes.
That's very nice, yeah. But tell me one thing, does it substitute or does it replace lifting?
No, it cannot replace lifting, but it's a substitute when we have just a beginning
of relâchement.
of relâchement. But when we have a very important relâchement there and there,
Yes.
we need to do a French lifting.
Yes.
The French lifting is a very natural lifting en agissant sur les muscles with the
Okay.
muscles
Yes.
and very discreet, very confidential scars. Sometimes we have just a problem in this part.
Yes.
Sometimes just in this part. We don't need to do everything.
Ah, okay.
And we don't need to pull too much
Yes.
because if we pull too much, it's not natural.
Yeah.
It's a
Okay.
surgical looking face
Yeah.
and we don't want that.
Ah, okay. So do you think these are for old ladies, young ladies, or it's just like better than going into injections or this is a solution which is very, it's not permanent.
It's complementary.
Yes.
Because for the neck and for the oval,
Yes.
we need the threads,
Yes.
but it's not enough for that.
Yeah.
And we put fillers in this part,
Yeah.
and we put Botox for this part and this part.
Ah, okay.
It's complementary.
Between us, which is better, lifting or the thread?
When it's just light,
Yeah.
threads is better.
Okay.
But after 50, 55 years old, sometimes you need to have action on the muscle,
Yes.
and for that you need a small lifting.
Okay.
A mini lift it's enough.
I mean, what's the difference between the mini lift and the lift? All together you have to be operated. So
Yes.
what's the difference?
It's the importance of the action, the importance of the surgical undermining. A small lifting, we are working just there and just doing this. A big lifting, we have to make action on this, and it's a large undermining.
Yeah.
And a big lifting, we can make something there. We don't need that if we want to
okay.
stay natural.
Pourquoi vous faites le lifting?
Pourquoi j'ai fait Parce que ça m'a dérangé un petit peu d'avoir un peu de peau ici, et puis
Ouais.
bon, un petit peu autour des yeux peut-être.
Ouais.
Mais non, c'est bien,
Ouais.
je suis contente.
Ouais. Pourquoi vous faites le lifting?
Pourquoi j'ai fait Parce que ça m'a dérangé un petit peu d'avoir un peu de peau ici, et puis
Ouais.
bon, je trouve que quand même, quand il faut,
Ouais.
c'est quand même agréable.
Ouais.
C'est pas tellement pour faire plus jeune.
Ouais.
C'est pour ne pas avoir tous ces trucs qui ne sont pas beaux, comme
Ouais.
peau qui pendent, les yeux un petit peu, les paupières qui tombent.
Now we want to move to the latest technology you created, and you're so famous in this, hair implants. Now, you know what? There is a lot of stress, there is a lot of crisis, many people lost their business, emotional shocks, and all this is translated in hair. There's the menopause for ladies as well. People, they are, complaining of the hair loss. Professor Sydney Ohana, what's your latest creation in this?
The best technique is to do everything with the hands and
Yes.
not with machine and not with robot.
Yes.
Because with the hands, it's a perfection that we can do
Yeah.
with microscope. And since a few years, we have now a new technique with a needle like this.
Yes,
And the hair that we take, the follicle,
yes,
is inside a very small, very small needle.
Yeah.
And you know when you use a small needle,
Yes.
we have no marks,
yes,
not at all. It's not like with a scalpel
Yes.
and with if we use something to put the hair inside, a forceps. No, just a small needle and just 1 millimeter.
Yeah.
It's a long job, but a very, very natural and nice result, one by one, without scars.
Wow.
And without scars. We can spend all the day, 6, 7, 8 hours to have a nice result like this one. I did it.
Yeah.
And
You did it yourself
yes,
for your hair.
yes, and you can see if you want,
Yeah.
you will not see any scar on my head because
I'm not aging, you're giving me the look.
no, to control.
Yes.
You will not see any scar because it's
Yes.
only with this small needle.
Okay.
And this is a very, very big progress.
So just to make just for myself to understand better, we have the needle, and inside the needle there's your hair.
One
follicle.
hair that we take there
Okay, and just
with a bubble,
Yes.
with a follicle, and we inject it.
Okay.
We
Okay.
just inject it.
Okay. So you take so many from the back and you inject in all the
We
places
can
where it's
take
empty.
1,000, 2,000,
Yes.
and to have enough hair in this part.
Wow, that's a long procedure, but this is very natural as well.
Absolutely natural, your own hair,
Yes.
and without any scar, and without any pain, any marks. You can go to your job one day later.
Yes, and it never falls down again.
Never, never, never.
Wow, that's amazing. Even as I mentioned, the menopause woman, all the hair is falling. So if they follow up this procedure, it is successful.
Yes, we can use it when women are empty in this
Yes.
part. You can inject,
Yes.
and it will be more nicer. After 25 years old for
Yeah.
men,
Yeah.
and more later for women, because most of the time it's more later for the women.
You created this technique because of your hair?
Yes.
Because you lost your hair.
Yes,
That's
exactly.
amazing. That's amazing. And anybody else is using this technique, or it's just you?
In the South Korea,
Yeah.
they make a very good job with that.
Yeah.
And now in Greece, they are beginning. In all the world, it's beginning.
Néanmoins, j'ai subi une opération des paupières qui s'est vraiment bien passée et je suis satisfait du professionnalisme de M. Ohana parce qu'il est vraiment à la perfection et je suis vraiment content du résultat. Comme vous pouvez constater, ça fait que 3 jours et mes yeux ne sont même pas enflés ni que ce soit. Bien entendu, j'ai suivi avec et à la lettre le traitement que M. Ohana m'a remis et je suis vraiment satisfait du résultat. Voilà. Donc j'ai eu l'occasion de faire donc, les paupières. J'avoue aussi également que j'avais fait quelques petits retouches au niveau des cheveux. Il n'y a aucune marque. Donc ça a été fait vraiment à la dernière technologie par Dr Ohana. Et ça a vraiment fait un résultat extraordinaire. Au bout de 3 mois, j'ai eu des repousses et aujourd'hui, je suis vraiment content. La clinique ici, Petrac, est une clinique extraordinaire. J'ai eu l'occasion de faire également une liposuction où j'ai eu un peu au début un petit peu la peur de le faire, mais ça a fait un résultat extraordinaire.
نهار كتير طويل وبين العملية والعملية انه خلص يعني كتير تعبنا ولازم نتغدى. نهار كتير حلو مع بروفيسور سيدني أوهانا. خليكن معي وخلينا ناخد بريك صغيرة، انتو بترتاحوا ونحنا كمان وبنرجع سوا لنكفي حلقتنا One Day with Professor Sydney Ohana. Bon appétit!
Merci Claire. Allez.
about the breast, to increase the breast size, we have like the lifting for the body, for the tummy, the nose. So these are normal operations, but any new technology in these normal operations?
We have done very big progress with a breast implant.
Yeah.
And also with abdominoplasty.
Okay.
Because for the breast implant now we know absolutely how to put the implant. We have very good material.
Yeah.
We are very.
What is this material?
It's silicone
Yes.
cohesive. It means it doesn't. We cannot. On peut pas le casser. We cannot
Yes.
break it.
It cannot be break.
Yes.
But silicone, does it make cancer?
We are absolutely sure now that there is not one cancer with silicone.
Okay.
No one. We follow the patient every year with echography, mammography,
Yes.
and we can be very safe with this technique. We can use it behind the muscle,
Yes.
before the muscle, to have a very nice looking,
Good.
and we can keep them more longer now.
Yeah.
20 years,
Oh,
more
wow.
longer. Yes, the new
Wow.
ones are very good.
Very good.
This is a big progress.
That's
And
nice.
for the abdominoplasty,
Yeah.
now we know exactly how to combine abdominoplasty and liposuction to have a nice shape and to do a job on the muscles,
Okay.
all at the same time with general anesthesia.
I will not call you Professor Ohana, I will call you my sculpturer. The sculpturer. This is a very big job to do, huh? And you know what? Nowadays, besides the lifting, besides the silicone, besides everything, what about the radio frequency? We need a good skin. We need, a skin which is not only we have the fillers, we have the Botox. We need to be shiny, radiant, with a nice smile. So what about this radio frequency?
We can use radio frequencies and laser
Okay.
to have a nice skin, to take away the redness, varicosité,
Yes.
pour avoir les pores,
Okay.
les pores plus rétrécis,
Okay.
une peau fine,
Okay.
pour diminuer les cernes,
Yeah.
les taches
Brune.
les taches brunes, les taches de grossesse,
Okay.
tout cela grâce au laser et
Et
la
radio
radiofrequency.
What's the difference between lasers and radio frequencies?
Le laser, il permet de chauffer les fibres collagène en profondeur
Okay.
et de retendre la peau.
Okay.
La
Radiofrequency.
radiofréquence. Le laser, lui, il peut agir sur la couleur des vaisseaux, sur les pigmentations, sur les tatouages.
Okay. That means it stimulates the
Yes, it's a
the
stimulation
collagen.
of a deep collagen and elastine.
Okay. But if it's burning,
Not
does
at all.
Not at all.
Not at all. It doesn't burn the epidermis.
Yes.
It chauffe, it's heightened inside, deeply, and not superficially.
Okay, but how many times the lady must do this, to have a good result?
To begin to have a good result, you have to do between 5 or 6 sessions.
Yes.
And after that, you need an entretien.
Okay,
One
maintenance.
session every 3 months.
But how long does it last?
It lasts 3 months, but with only one session, it will stay
Yes.
6 months. You have to entretenir.
Really,
Absolutely.
I'm happy because I will be working with you later on. And what else do you have? You are an author.
J'adore communiquer, j'adore expliquer les choses.
Okay.
C'est pour ça, c'est un besoin pour moi.
Okay.
De-
And you wrote in different languages. You want to reach everybody. Okay. You are the president of Hadassah. Hadassah, it's a humanitarian association. Former lady, Carla Bruni, she's the ambassador, and you are working side by side with her. So give me more idea about this Hadassah.
Hadassah, it's a very big international organization, ONG,
Yeah.
with about 400,000 persons in the world working for that,
Yeah.
giving money for that, because we help in many places in the world, in many hospitals. We help for the research, and we help for the patients, and for the all very big malady,
Yes.
like sclerose en plaques,
Yes.
like all what you know.
Even open heart, you were telling me.
Open heart. For instance, we have an hospital in the Moyen-Orient, and every day we are doing operation for young baby Palestinian,
Yes.
because they have many heart disease,
Yeah.
and every day we do one with operating
Yes.
hearts for this the small babies.
Yes.
We help in the Darfur,
Okay.
we help in the Haiti when there were earthquake
Yes.
in Turkey.
Yeah.
So it's very important, very big.
Yeah.
I'm the president in this part of Europe.
It's
It's donation, and with this donation we help scientific, and we help without any difference between the religion, the
Yes.
color of the skin, not at all.
It's for
in,
everybody.
in all the world.
Il existe deux sortes de fils, les fils crantés et les fils non crantés.
Ouais.
Les fils crantés, ce sont des fils qui ont été fabriqués avec des multiples aspérités ou cônes qui s'accrochent à la peau
Ouais.
pour corriger l'affaissement ou le relâchement du visage, du cou ou de certaines zones même du corps.
Ouais.
Ils sont introduits dans la peau grâce à l'aide d'une aiguille très fine qui ne laisse aucune trace ni cicatrice. Il existe d'autres fils qui ne sont pas crantés, c'est des fils simples qu'on introduit dans la peau du visage, dans la peau du cou, dans la peau du décolleté, au niveau de la partie intérieure
Ah bon?
des bras, au niveau de la partie intérieure des cuisses, et qui sont des petits fils qu'on met partout pour induire la fabrication de collagène. Et ça densifie la peau, ça la rend plus épaisse. Et donc cet effet-là, cette densification entraîne une rétraction et un rajeunissement de la peau. Les fils sont fabriqués avec une matière résorbable qui nous permet de travailler en toute sécurité. Et c'est ça le phénomène nouveau,
Ouais.
c'est le fait que les fils sont résorbables. Les fils résorbables, il faut savoir que les fils tenseurs ne remplacent pas le lifting,
Ah oui, c'est
ne
ça.
remplacent pas les injections, mais ils ont une place particulière.
Ouais.
Et tous ces éléments-là permettent à la médecine esthétique de rajeunir un visage. Moi, ce que je pose comme indication pour les fils, c'est qu'il y a des patientes qui ne veulent pas avoir de corps étranger, enfin, ils ne veulent pas avoir d'injection, elles font une phobie, elles n'aiment
Ouais.
pas les injections.
Ouais.
Donc, vous leur proposez les fils.
Ouais.
Des fils au niveau des pommettes, au niveau de l'ovale, ça leur donne un effet lift qui les rajeunit
Ouais.
et ça leur fait plaisir. Avec ces fils, on réanime un lifting, c'est-à-dire
Ah.
on le rend plus frais, plus
Ouais.
jeune et ça donne un effet assez remarquable. Ces fils induisent la fabrication de collagène et de la fibrose. Donc c'est une cicatrice interne qui ne se voit pas à l'extérieur et qui entraîne une traction. Donc elle retend la peau. Les fils restent dans la peau pendant un an et demi. Et la fibrose, le corps fabrique de la fibrose autour de ces fils, du collagène. Puis il se résorbe, mais c'est cette cicatrice interne qui continue son travail.
Quand elle me prend dans ses bras, elle me parle tout bas, je vois la vie en rose. Elle me dit des mots d'amour, des mots de tous les jours, et ça me fait quelque chose.
نوصل لاخر بارت من الانترفيو تبعتنا مع بروفيسور اوهانا. Oh, really, it's a very nice interview. I'm very happy. I don't want to go back. I don't want to finish the interview. That's amazing, knowing so many things behind the successful story. So we know that you got so many prizes, so many Nobel Prizes, even with the President Sarkozy. So can you give us a briefing about this accomplishment?
In 2005, we were Nobel Prize on the list of the Nobel Prize for all the action of Hadassah in the humanitarian fields. And 2 years later, I had the Légion d'honneur from the hands of President Sarkozy for all this activity in humanitarian action.
You are dedicated, you travel a lot, you help a lot.
I spend a lot of time to help the others, to educate, to make surgery in Africa, in somewhere where it's very difficult for them to have benefits of this kind of surgery.
You are so quiet, and even before and during operations, and you are always calm. So why?
You know, I have never been stressed in my life, never been hungry against something or someone. Because I know exactly where I'm coming from, where I am going on. I have my philosophy of a life, and without, I feel very happy. I think that j'ai beaucoup de chance dans la vie, in the life.
Wow, that's great. You know, but major part of your business, of your work, I can say, it's women. Are you in love?
I have a big respect for women. I think that they are very high level, more than men. Ça va pas plaire aux hommes, mais c'est pas grave. Ça va plaire aux femmes. Et c'est ce que je pense vraiment.
Everybody watching us right now, especially the Arab ladies, European ladies, everybody. What kind of message Professor Ohana from his clinic, from Paris, with love, what can you tell them?
I have many Arabic women from Arabic country who come to see me. And I have a constellation. They have a very good taste. They know what they want. And we have to do what they like. I tell them only one word. I love you all, shukran.
Wow, we love you as well, and I have to thank you so much for the wonderful day, for the one day with Professor Ohana. It was really lovely. 35 years of work. You did an excellent job. Thank you for receiving me here in your clinic, giving us all your time. You know, and I know that you canceled your radio show. By the way, I need to mention for everybody that Professor Ohana every Friday has a radio show giving hints and tips and latest technology in the plastic surgery. As well, he's very well known worldwide, always TV's interviews, and I was very lucky that I can get the interview very quickly. Anyway, I have to thank you so much. It was amazing spending the day with you. It was really lovely. Hope to see you very soon in Beirut.
I will go to see you. Thank you, Claire.
Oh, thanks for you. مشاهدينا، حقيقة كان نهار كتير حلو. إن شاء الله تكونوا حبيتوا هالحلقة. إذا حبيتوا حلقتنا ما لكم إلا تنطروني الأسبوع المقبل بحلقة جديدة، لايف ستايل جديد وموضة جديدة. أنا بودعكم بقول لكم من باريس. From Paris with love.
Il te reste à perdre quelques kilos. Docteur Ohana, lipo. Les garçons, tu dois te méfier. Rihanna, visage tu méfié. Paris la nuit, c'est pas la colo. C'est plus un film